Thank you. Okay, it looks like those joining this evening have slowed down, so want to be conscious and honoring of everybody's time, so we will go ahead and begin. Thank you so much for joining us for our evening town hall. My name is Courtney Davis. I am a senior consultant with RDA Consulting and working with the County of Santa Cruz Behavioral Health Services to do the MHSA 3-year planning and community engagement pieces. So I will be sharing a few slides and overview pieces this evening. Also have Lauren Fain and Karen Kern here to share updates and program status reports from Behavioral Health Services as well. So we'll move through all of that this evening. If you're just joining us, welcome. Please put your name and preferred pronouns into the chat box. There's also a demographic survey link. There is an English and Spanish version. Those will be in the chat. They're also accessible from the slide. So if you can fill those out, we would be very appreciative. Okay. So really what our goal is this evening is to share and update community members about what is the MHSA, the Mental Health Service planning process, and what are the current funded programs that Santa Cruz Behavioral Health Services are doing, and how do we continue to ensure that those programs move forward that are client-centered, community-centered, and informed by what you, the community, are seeing, hearing, and experiencing when it comes to mental health and behavioral health needs. So we're going to go a little bit just over what the Mental Health Services Act is. So I'm going to say MHSA a lot, but that is the Mental Health Services Act. We're going to talk about what the planning process is. Karen and Lauren are going to share some of those status updates about what current MHSA programs and services are doing in Santa Cruz County. And then we're going to save some time to have some facilitated conversation, and we're going to leave you with what are some next steps, what are ways to continue to be involved during this planning process and throughout the engagement period. So we will move through all of that tonight. Again, thank you for joining us. If you're just joining us, go ahead and throw your name and your pronouns in the chat, and there is a demographic survey there for you too. Thank you. All right, just a few housekeeping pieces since we are on Zoom this evening. We can revisit the slide when we get closer to discussion, but did just want to revisit. You are welcome to share any comments in the chat. We are going to have time this evening where we hope some of you will be interested in coming off mute and sharing with us your experiences, your thoughts, your takeaways from what we share this evening. To do that, you'll be able to use the raise hand icon. If you are joining us by phone, you can raise your hand by pressing *9. I have some team members on this evening who will make sure that we get to any raised hands or individuals who want to make those comments. But you do have both of those options, either to share with us verbally or to include things in the chat. Did just want to note we are recording this evening's presentation, and we will have this posted on the MHSA YouTube site for Santa Cruz County Behavioral Health Services. So this will be up within a day or so of this evening. On that site, you will be able to continue to give feedback. You will be able to make comments there. Those will all be included in community engagement and comments made. Okay, let's talk a little bit about the Mental Health Services Act. and really try to set up our conversation this evening of what this is, why this is important to behavioral health services and Santa Cruz County. So MHSA, also known as Proposition 63, passed back in 2014, November 2nd. This was passed by the voters and codified into law. What it is a 1% tax on income over $1 million, and that is to expand and transform mental health services and reduce negative impact to individuals and communities from untreated mental illness. So this does not impact everyone when you are talking about that 1% tax that is only over income of 1 million, but it does provide funding to really innovate and transform mental health services in California. The Mental Health Services Act, MHSA, is unique to California. This is not something that exists in most states across the country. MHSA really is founded and promotes 5 core values and guiding principles. Those are wellness, recovery, and resilience. So really being proactive and ensuring individuals do not deteriorate before receiving services, being an integrated service experience. So really leaning into that innovation and that transformation piece, client and family driven services. So really centering those who have lived experience and driving the service planning forward based on experience sharing, feedback, and needs of the population served. Really ensuring that plans and work under MHSA is culturally competent, and so that cultural competency piece, reaching the unserved, the underserved, and hard to reach populations remains a priority focus of MHSA and MHSA funded programs. And then really that community collaboration piece, which is tonight, as well as many other activities that we're going to be sharing with you at the end, opportunities to be engaged, to be part of the process, to have your voice matter in the planning and then the forward execution of MHSA programs. This really is about expanding and initiating innovative mental health services. This is something that really provides a predominant funding source for many counties as well when we're talking about mental health services across California. So when we look at MHSA funding and what that means in operation, there are 5 different components of the Mental Health Services Act. I'm not going to go into depth of all of them because you are actually going to hear later from Lauren and Karen those programs in operation currently in the county of Santa Cruz. But those 5 components are community services and support, and under that there are 8 different categories that we'll hear about later this evening. Those are really outreach and direct services for serious emotional disturbances or serious mental illness, and those reach across all ages in different ways. So again, we're going to revisit that later this evening. There are the prevention and early intervention, which PEI is what you'll hear with that, but prevent the development of mental health problems and screen for and intervene with early signs. So again, this includes some different areas that you're going to hear about later, but prevention, early intervention, suicide prevention, access and linkage to treatment, stigma and discrimination reduction, outreach to increase signs of mental illness. So really looking at some of those prevention and early intervention pieces. Then there's the innovation aspect. This is usually about 5% of the total budget. And this is really meant to support learning, research, pilots, and other innovative programs and services within counties. This is where that local control and that planning really matters of what this looks like is unique to every county. It's an opportunity, though, that provides one-time funding. So the innovations funds are really not meant to be sustainable forever. These are short periods of funding during the 3-year planning cycles, but to test new approaches that may improve outcomes for communities. The other 2 are workforce education and training. So really about building, retaining, and training a strong public mental health workforce and continuing to have that infrastructure in place to serve communities. And then the final component is capital facilities and technology needs. So this is really thinking about your infrastructure to support your services. Things such as facilities, electronic health records, those key components that ensure the rest of our services are integrated and working well together. So when we're looking at this, there are two parts that you often hear about with MHSA. One is the 3-year plan, which is that engagement piece that we're working on now, really building a roadmap for program and service delivery. So every 3 years, entities that receive MHSA funding must submit a plan that details the programs being administered, budget allocations, program updates, and/or implementations. Must also include populations and communities being served, as well as links to most recent outcome measures and reports. Then within those 3-year plans, so right now we're looking at 2023 to 2026, but within those 3-year plans are annual updates. So counties are required to provide community members with an update to the MHSA 3-year plan on an annual basis. There are many other components to MHSA, and so if you would like to continue to learn about MHSA funding and programmatic pieces, you can do that in a couple different ways. The County of Santa Cruz Behavioral Health Services website has a number of resources and really great information to continue that learning journey. You can also go directly to the California Department of Healthcare Services MHSA website. Okay, so before we pivot to some updates about what programs are currently doing in an operation, let's just visit real quick what this 3-year planning process is going to look like. So what is happening for the current 2023 to 2026 3-year plan? So really, what is the purpose of this plan? And this is to identify persistent mental health service gaps and develop strategies to address them over the next 3 fiscal years based on community needs assessments and stakeholder input. So again, looking at that quantitative data, that qualitative data, really understanding what community is saying are important and what those needs are, what those gaps are, and how can those be met. And engaging in a community planning process. So really, the MHSA intends that there be a meaningful community and partner process to provide subject matter expertise to the development of plans focused on utilizing MHSA funds at the local level. So we're going to revisit those at the end, but we'll have a timeline here to talk about that too. Before we get to that timeline, just really want to talk about some of the key stakeholders that are important to MHSA planning and execution. So program planning shall be developed with local community, and the partners that might include are adults and seniors with severe mental illness, families of children, adults and older adults with severe mental illness, providers, law enforcement partners, educational agencies and partners, social service agencies, veterans and other representatives from veterans organizations, those who provide alcohol and drug services, healthcare organizations, and then really specifically engaging in Santa Cruz County, our family resource centers, and working with diverse communities that represent the service area. So thinking about our Latinx, our homeless, our LGBTQ+, communities of color, and immigrant communities. And within that, there's a few different groups and partners that really come together to continue to engage and do that planning forward, both in this planning phase and in the implementation. So one, importantly, our community and partners. This is where we really get those shared experiences, ideas, and individual perspectives and reflections of what are those community needs and what are the strategies that will best meet those needs. There's then the Santa Cruz Behavioral Health Services. So really the responsibility of developing the MHSA 3-year plan that is reflective of those community needs, outlining those priorities, and identifying the strategies that will be implemented. There's the Mental Health Advisory Board. So this is the board that will support partner and community involvement, will be responsible for reviewing and advising on the 3-year plan, and will conduct a public hearing following the public comment period. And we'll look at a timeline of that engagement here in the next slide. The County Board of Supervisors is responsible for reviewing and approving the MHSA 3-year plan. And then our role, RDA Consulting, is really to support community research and engagement, help pair those together to share findings and facilitate conversations to support the actual compiling of the 3-year plan. So if we look at what to expect over the next couple weeks, some of you may have already seen this first part, but there is a community feedback survey to really get as much broad input and participation as we can across Santa Cruz County. That survey is available in both English and Spanish. It will be available through the end of February here till the 27th. At the end tonight, we are going to share those links. They are also already posted on the Santa Cruz County Behavioral Health Services MHSA webpage. Then we have tonight's education, town hall, and listening session, which then again at the end, we're going to talk about opportunities to even be involved in deeper conversations. So next week, hosting focus groups, some with providers of mental and behavioral health services, some with those who are receiving services or might have family or friends who are receiving services, or interested community members that want to be a part of the conversation and share what they are experiencing. Then after all of that, when the plan is drafted, there will be a 30-day public comment period. So this is an opportunity where community can access that draft, review, provide feedback, provide comments on what they see, what they'd like to see, and then that is incorporated at the end with a public hearing with the Mental Health Advisory Board that was mentioned before the final plan is then drafted. So with that, I'm going to pause and we're going to shift over to hear about what are the current MHSA funded programs and services in Santa Cruz County right now. So I will stop and hand over to Lauren.
Thank you, Courtney. Good evening, everyone. Can you advance the slide, please? Thank you. So first, we're going to talk about community services and supports. And what this component of the plan is to provide services and supports for children and youth who have been diagnosed with or may have serious emotional disorders, and older adults who have been diagnosed or have serious persistent mental health. And so as we go through each of these work plans, we'll talk a little bit more about what that specific work plan is about and what providers are currently providing services under that work plan. Next slide, please. Okay, so the first community and services and supports program work plan is program number 1, and this is Community Gate. And the purpose of this program is to create expanded community-linked screening, assessment, and treatment of children and youth suspected of having serious emotional disturbances, but who are not referred from our system of care public partner agencies. So when you think about services and various points of entry, these are not from probation, child welfare, or education. This is strictly from the community. And the current providers of those services is County Children's Behavioral Health, and they have services in both North and South County. Encompass Youth Services, again, services in North and South County, and Pajaro Valley Prevention and Student Assistance, or PVPSA, who have Mid-County and South County services. The second work plan is around Probation Gate, and the Probation Gate is designed to address the mental health needs, which includes assessment, individual, collateral, group, case management, and family therapy of youth involved with or at risk of involvement with the juvenile probation program. And the programs or the organizations that are currently providing services under this work plan are Encompass Youth Services in North and South County, and PVPSA in Mid County and South County. For the third work plan, this is a child welfare services gate. And so this gate, the goals are designed to address mental health needs of children who are connected to the child welfare system. And the providers of that at this point in time are the Parent Center in North and South County and Children's Behavioral Health, both in North and South County. So the fourth work plan is around education. And so this is another point of entry for youth. And this program is designed to create school-linked screening and assessment and treatment of children and youth suspecting of having emotional disturbances, as well as specific dual diagnoses in both mental health and substance use. And these referrals are coming from local schools, not necessarily through special education, but just through the mainstream school connections. And then for the fifth work plan, this is a special focus on family partnership. And so this is through the Volunteer Center, their community connection program. And what it does is it's designed to expand family and youth partnership activities provided by parents and youth who have been served by our children's system of care. So this is almost like peer partners. They're partners that have had lived experience in our system of care that are now working with families who are accessing services. There's other areas of our agency that also have family partners, but specifically as it relates to Mental Health Services Act, this is the parent, the Volunteer Centers program on family partners. And then I believe now Karen is going to take over.
Thank you, Lauren. Hi, everybody. So I'm going to talk a little bit about more of our adult services and the work plans relating to those. Work plan number 6 is enhanced crisis response. This work plan provides enhanced 24/7 supports to adults experiencing significant impact in their level of functioning in their home or community placement to maintain functioning in their living situation or in need of risk of psychiatric hospitalization, but are able to be safely treated on a voluntary basis in a lower level of care. And then the third category for this work plan is individuals being inappropriately treated at a higher level of care or incarceration and able to step down from psychiatric hospitalizations or locked skilled nursing facilities to a lower level of care in the community. And the programs that this past 3-year plan has supported is Telos, our crisis residential facility, El Dorado Center, which is a post-hospitalization or hospital diversion program, and then Casa Pacific, which is residential treatment for co-occurring mental health and substance use disorders. Next slide, please. Thank you. Work plan number 7 is around consumer peer and family support services. These services and supports are intended to provide peer support, which is empowering and instills hope as people move through their own individual recovery process. Services are available countywide, also culturally competent, recovery-oriented, peer-to-peer, and consumer-oriented. And then the 2 North County or Mid-County, Mid to North County MHCAN, our peer drop-in center. They have weekly peer-run programming. They do a lot of outreach and support for individuals with psychiatric disabilities. They also provide, for example, transportation to people to appointments if they need it. They've got both drop-in and scheduled programming, and then they run the Transition Age Youth Academy. And then in South County, we have Mariposa Center, which is run by Volunteer Center. They also have drop-in and weekly peer programming, and then they also do outreach and support for individuals with psychiatric disabilities. And then the next slide is our work plan number 8, and that is community support services. And so these services and strategies are designed to advance recovery goals for all consumers to live independently, engage in meaningful work and learning activities that are central to the enhancement of quality of life. Participants are enrolled in full service partnership teams. Full service partnership teams are partnerships between clients and clinicians that include opportunities for clinical care, housing, employment, and 24/7 service availability of staff. And then at the county, those teams are both in North and South County. Our recovery teams are most, which is a team that works with adults on probation, and then our older adult services for adults 60 and up, who also have often co-occurring medical issues. And then we partner with Community Connection to provide that the meaningful activity, housing support, college connection, employment services, and then also just the case management around those types of services. Next slide. Okay, and then the prevention and early intervention is really looking at, for adults, we're looking at our Veterans Service Agency. We have a Veterans Advocate that supports veterans in our community with mental health issues and connecting to services. You want to talk about COE, Lauren?
Sure. So COE, basically, they have a school mental health partnership in which the funding supports the Diversity Center, positive behavioral interventions and supports, and the Live Oak Resource Center. The Diversity Center provides support services for LGBTQ+ students throughout the county. Services can include Gay Straight Alliance, GSA groups, and offering LGBTQ+ counseling and advocacy and friendly pro-social events. PBIS, Positive Behavior Intervention and Supports, is really an intervention that is brought to, it's a curriculum that is integrated into schools to provide basically a tier 1 or a universal level of support to school students to increase social emotional learning. And so it can be everything. When successfully implemented, it really establishes clear expectations, emphasizes recognition for positive behavior, and creates a school culture that's stable and consistent across the campus. And then the third part of that is the Live Oak Resource Center. And the funding there goes to supporting and strengthening families by providing case management, counseling services, and coordination of parent education classes.
And then our partnership with Senior Council provides senior partners, which are like peer support for older adults and just seniors in the community that come to our groups that we have at the county clinics, our one-to-one peer support for older adults who might need additional support out in the community, to work with people to sort of navigate systems, or just be that connector and have like basically a person. And then do you want to talk about Triple P?
Yeah, so Triple P stands for Positive Parenting Parent Program, and it's offered through First 5, and it's a prevention program that provides a 5-tiered public health model of progressive mental health information, prevention, training, screening, and early intervention. It's an evidence-based practice that's used throughout California.
And then also for early intervention, we have our access services at both North and South County, and those work with all ages, just to really ensure that we're assisting people as they come to us with needs, whether they're specialty behavioral health needs or whether they meet the mild, moderate to moderate criteria. And we want to make sure that we're connecting them to resources in that moment of presenting. And then we also have Wellness Connect, which is working with transition age youth primarily, but the focus of that program is first episode psychosis, and really looking at supporting people who are experiencing their first break and providing an enriched set of services to ensure that they are getting the support they need. And that particular program includes a broad range of services, including therapy and case management, as well as there's a family partner and they say peer support and employment and education support. And then Family Service Agency is our suicide prevention partner, and they are the arm for suicide prevention for us here in the county. Next slide. Okay, and then also under access and linkage to treatment, we work with Second Story, which is an all peer run respite house. Open to anybody in Santa Cruz County who basically is experiencing, mental illness, but also needs a respite from whatever situation that they're in. And so we find that is a way for people to come and get out of the situation, whatever the living situation they're in, and be in a place where they are safe and where they can hang out and have peer support, and potentially then get access to other services from there. We have our mobile emergency response team, which is MERT. We have MERT for adults and then MERTI for youth. And that is a team of clinicians who respond to crises in the community. And then we have our mental health liaisons, also working, currently we have Watsonville and Santa Cruz PD, and then also the Sheriff's Office have liaisons that are working 7 days a week to co-respond with law enforcement if a call comes through 911 with somebody in mental health crisis. And then Family Service Agency Senior Outreach Program is really looking at working with isolated seniors, ensuring that they are connected and not alone, connecting them into services and making sure that they're just connected. Thanks. Next slide. Yeah. Cool.
That's back to me. Thank you, Karen. Thank you, Lauren. We are going to move to a time of a bit more opportunity for you to share and share your experiences, thoughts on the broader system or what was shared here tonight. But before we do that, are there any questions to the program sharing for Karen or Lauren? I don't want to miss those. Just a reminder, if you are on the phone, *9 will raise your hand and we'll know that you have a comment or a question. And then if you are joining us on Zoom, you can use the raise your hand and we'll make sure that we get you into the conversation. Okay. Oh, I think I am seeing a hand. Is it Serge?
Yeah, thank you for the presentations, Karen and Lauren. And how do new programs get presented and get considered by the community from MHSA funding?
I'll take that. That's a great question, Serge. And so I think what we're hoping as part of this process that we're starting tonight is that we're going to get feedback from all of you and other people in our community with the upcoming events that we're having. And also, maybe most importantly, in some level, is that survey that we are going to provide links at the end. And then there's also a QR code on our website that you can use to take the survey. That is how we get your input, and your input is what drives the planning process. So we want to hear from you. We want to understand what's important to our community. And that might be, there's a place for comments. That might be, comments about current programming. That might be gaps or barriers that you have observed that you think we need to pay attention to. And then we gather all that information and sort of look at what are some of the top areas that our community is interested in having us work on, and we create the next 3-year plan from that.
Thank you for answering that, Karen. It looks like we have had a few other hands pop up. Dee, I saw your hand first, and then Mike, I'll move to you after that.
Hi, I came in a tiny bit late, so it might have already been answered, but the only place I saw NAMI was on the lowering discrimination. I would have thought that would have been included. I just wondered if it was supported by this funding, and hopefully it's in. I don't see parent support on this list anywhere, but I wondered if that was being supported and if NAMI is in that category.
Yeah, I can answer that. NAMI is funded by MHSA, and I can pull up, it falls under stigma and discrimination reduction. So that's where our local chapter gets funding. And then as far as parent support, I would say there's a multitude of areas where parents are supported. Any of the direct services of those gates that I mentioned in the community services and supports, whether it's EdGate, probation gate, foster care, community gate, we always, when clinically indicated, try to encourage parent engagement and connection. There's also the family partner program, and that's another area where parents are included. Any of the youth-based services, whether it's also all those school-based services I named, parents are always, we try to get them involved as much as possible. And then the Triple-P parenting program is specifically targeting caregivers to have support around parenting practices and just how to kind of strengthen their skill set as parents.
Well, I guess I was, as a parent, I've just had significant support from NAMI. And I would
I see.
I would just like to make sure they're being funded under something other than discrimination. Are they getting funds for their role in parent education as well as peer support?
I think that, go ahead.
Go for it, Karen.
Okay, I think that the sort of the category of stigma and discrimination reduction is what we use for the MHSA funding for NAMI, but NAMI has a broad platform of all kinds of different services, including family support that are funded. So it just, I think it may be a little bit of a misnomer, or
I was wondering about that.
Stick it in that, but that's kind of how we've organized it.
Okay, as long as they're being funded, thank you.
We love.
Sorry, maybe I didn't understand the question exactly. Thank you, Karen, for clarifying for D.
Mike, go ahead.
Okay, thanks. And it sounds like D is a shill for NAMI, which I appreciate. So I'm on the board of NAMI, and I have some input. First of all, just kind of recognition and praise for all the work that the county has done around their different programs, MRDA, the mental health liaisons, the decision to start up a new child care facility, the grant you got on Healing the Street, integration you're doing with the 988 number, et cetera, and all the work you've done through COVID is really admirable. So, I'd like to say that, that's a baseline for all the programs you've done and the expansions you've done in the tough times. So thank you for that. As I look at the priorities for the future, there's kind of two categories for me. One is kind of expanding some of the great work you're doing. So for MRDA, that would be maybe more hours, more days of coverage. For the mental health liaisons, maybe a few more of those individuals working with the police would be great. And then expanding more of your most teams or your case management would be great in terms of, current capability expansion, building on your success. As I look at the new additions, I think if we could have a new adult step-down facility, that would be fabulous. That would be one. Maybe implementing some intense outpatient programs that don't take capital, but could really address people with SMI without being in a residential situation would be one. And then also a long-term issue I think we have is an expanded supported housing. So those three areas would be ones, if we were going to add capabilities, that would probably be priorities that we would suggest anyway.
Yeah, and if I could just take a minute hey, Courtney, didn't we have an innovation slide in here somewhere, or is that later?
We didn't have a specific slide, but feel free to go ahead and address that now, Karen, and then we can transition back into conversation.
I'm very organized by the slide, so if it's not on the slide, like, oh, I forgot. So the first thing I'll address is just the permanent supportive housing. Behavioral health is partnered with a couple developers, MidPenn and Eden, on 3 projects coming soon to our county. The one MidPenn project for permanent supportive housing is going to be at the 1500 Capitola, where they're building they've built the Santa Cruz Community Health Clinic in Dientes. There's housing going up there now. We'll have mental health units in that building. Also on Freedom, there's going to be one coming up through Eden, and then the Harvey West Studios, which is 120 units coming up on Coral Street. We'll have 59 of those permanent supportive housing units. And so we're definitely looking to expand really any kind of housing, but specifically supportive housing. And then innovation, I'm remiss I didn't speak about that. Sorry about that. We do have coming up, I'll put a plug in next week on Tuesday and Wednesday. We have 2 sessions at noon And I'll get, maybe Courtney, I can have you send out the flyer. Or I'm not sure how we can do that, but I'll make sure that somehow the flyer gets sent out if you guys didn't get it yet. We did try to send it out far and wide for yet more of your feedback and support in helping us focus our innovation plan. Right now, we are looking at partnering with, being part of a 5-county innovation plan project around the Crisis Now model. And so that focuses on receiving the call center, 988 call center, and mobile emergency response. And so one of the things that we're asking from the community is input on that 24/7 mobile emergency response piece. So hopefully we'll have some of you in those meetings next week as well.
Thank you.
All right, sorry, I apologize for that. I'm seeing a few more hands, and so I'm going to have us just continue to move into discussion, but I have also seen a few other people join us in the last little bit here. So I do just want to recap real quick and let everybody know we are recording this evening's session. So if you did join late and you missed a few of the beginning slides, this has been recorded. The entire evening's presentation, all the slides will be available on the county's MHSA YouTube site. We're going to give you that link here at the end. It's accessible from the Santa Cruz County Behavioral Health Services webpage as well. So I did just want to reiterate that if you're just joining us, you're at a great time to jump into conversation. But you can also revisit anything that was shared earlier after we wrap up this evening as well. So I'm going to pull on a few more hands. I am just going to progress to our next slide as well. So if you have things in mind to already share, please bring them forward. More program questions, that's great. But also just wanted to bring a few questions into space for others to think about. So what are some program and service strengths or successes that behavioral health services should continue to build upon? Mike, you kind of already started us off on that, so thank you for preempting. And then as you continue to think based on what you heard tonight and your lived experiences in the county, where are gaps that you see? Where do those still exist so that can continue to be captured in planning? And what can some of those programs that you heard about tonight that are continuing, what can they do even better to continue to serve the community over the next 3 years? So I'll leave this slide up if that helps as you're continuing to think about those comments. But I saw Susan's hand first, followed by, I think, Hugh and then Richard. So I'll try to keep these in order as I see them pop up. But Susan, please go ahead and share.
Hi, thank you for your presentation. I work for Santa Cruz County Public Health and our Children and Family Health Unit, and I'm wondering, has MHSA funding ever gone for perinatal mood disorder work, with the either pregnant or postpartum population? We have we serve quite a few women in this category, and we see them struggling, and there's lots of innovative programs where they kind of pair a mental health person with a nurse, or I'm just wondering if that's something you've considered.
I've been here about 2.5 years, so I was not part of the planning process for the last plan, but we can definitely log it, Susan, as a need. And I think that might fall under PEI.
And I'll just continue to reiterate tonight, we may not have the answer this evening to all of the questions, but Susan, that's exactly what we're looking to hear. Those ideas, those experiences, the things that you're seeing that will connect community. And so it looks like Karen's noting this, but also know we have many team members on tonight taking copious notes and making sure that what you are all bringing forward is captured and recorded for planning purposes. So thank you for sharing that. Hugh, I think you were next.
Yeah, thank you so much for allowing the community to be part of this process. I do have a question about, we mentioned innovations, but what about wet? You know, do you have a slide for that, or are we just going to like skip that tonight?
I could speak to that, Hugh. So wet funds are a one-time fund that we've exhausted. And so
Okay.
I apologize that we didn't name that, but we were kind of really focusing on what the previous 3-year plan had in it. And so, yeah, there's certain funds that use it and it's gone and that's it. And wet falls under that category. But thank you for that question.
Thanks for clarifying. Cool.
All right. Richard.
Can you hear me?
Yes, yes, we can.
Yes, hello, this is Richard Gallo. I'm a state ambassador volunteer with Access California, a project of Cal Voices, which is a statewide consumer-run mental health organization. I want to mention that one of the areas for parents, particularly in Santa Cruz County, that have gaps in services are those parents that have children with dual diagnosis of mental health and intellectual disabilities. They are struggling to get adequate services to meet the mental health piece of it, not the intellectual disability piece, because that falls under the regional center, but under the mental health services. And it's causing stress, breakups in families because of lack of inadequate services in Santa Cruz County, helping those families. Secondly, we need to expand Mental Health Client Action Network to a day program in the evenings out of the city of Santa Cruz area because of the restriction and prejudice within the neighbors around MHCAN, which is why they have the restrictions that they have the restriction, how many they can serve, what they can serve, and how long they can operate to serve the mental health need. This is a respite program that helps the individual's mental health, art recovery, support group, painting, discussion group, whatever it needs to be offered can be offered in that program. We also need to expand peer respite program is similar to the second story, whether it's in Santa Cruz or Watsonville, so that we have in all 3 areas throughout the Santa Cruz County instead of just in Aptos. The other need is we need 24/7 mobile crisis unit, not what we currently have that's limited. Part of the problem is law enforcement don't like to deal with the mental health community. I see their faces, I see their frustration, I see their impatience in handling and working with this population. And I understand they're limited as law enforcement because they only get X number of hours of trainings per year. The other area that we're missing to serve the mental health community is the lack of long-term supportive housing for the severely mental illness and the unhoused community. They have nowhere to go, period. We have great short-term crisis programs, but we don't have long-term programs to meet the need to break that cycle of homelessness. That's what the county needs to be aware of and needs to work on. And I know that takes time with affordable housing issue, considering with the high cost of price of land and building, but it needs to be done to help them get out of homelessness. There was another area, alternative to hospitalizations. The emergency room department is not the right setting for the mental health community to be stuck sitting there in hours getting inadequate help when they need to be somewhere else as an alternative to emergency room placement. Would they be able to get help with peers on site to deal with the mental health issues? And then the social workers there can handle, they either do referral to the PUP unit or refer to other placements that may be available, such as El Dorado Center, if they don't need the PUP facility. The ER is just not the right place for them. It's too traumatic, stressing. So that is my experiences in working with the mental health communities, working with a group of families are within the regional center system in Santa Cruz County who are struggling with a child not getting adequate mental health services that needs help. There is a program that's being paid for by MHSA in Santa Cruz County that Santa Cruz County may want to look at and copy and add it on as a service to meet these families, to be able to help them. NAMI Santa Cruz County does a fabulous job helping the families, educating about mental illness and how to work with its treatment to be able to help their child, whether it's a child or an adult child. Their life's heaven for the families, and I support them greatly. Thank you.
Thank you for sharing, Richard, and for sharing those thought out comments and ideas for moving forward. Thank you so much. I'm going to move to Serge next, and then Adrian, I see your hand. You're going to be up next after that.
Hi, thanks. For the first, the strengths, we have so many great programs that are doing so much work, and every one of them could get more money and build more services. I'm very much looking forward to the Crisis Now project to learn more 4/7 and to bolster up the emergency response for people in intense crisis. For myself, I think one of the things that is the type of project that it has great outcomes for people is the peer run kind of programs. And I think Santa Cruz could really use more of that. And as I mentioned that, I run a peer managed program. And I am just trying to make it more available as for different, I think more options for people, give them, they can choose a different community, they can choose a different feeling of the program that they want. So for myself, I advocate for more peer run programs, like even if we can say we have a couple, to say that we have more and people have choices so they don't have to do one specific one. So shout out for my own program. Thanks.
Thank you for sharing that. Yes, absolutely. And that lived experience of your own program sharing. Absolutely. Thank you. Adrian, I'm going to welcome you to unmute, and then Raymond, you'll be next.
Hello, everyone. I hope it's a beautiful night, and thank you for everything that you all have done. It's nice to see so much movement and mental health community. And so I think that it's much like the last couple of speakers. It's important to me that there are peer services. And I love the idea of expanding hours at MHCAN. I love the idea of more respite houses. But I think my specific ask will be that we can find ways to incorporate peer services into traditional programs. Maybe if we have a quota, one out of 4 workers throughout the system could be of a peer orientation, and which could perhaps create a lot of more connections, more opportunities to create together a system that can be moving more toward health and healing. And I think that we are moving toward health and healing. So it's not I think the efforts and the gains are incredible. And so I just want to really be mindful of that as well. That it would be beautiful if we could bring more peers into the traditional workforce.
Thank you,
That's all I have to
Adrian.
say.
No, thank you for sharing that. That's not all, it's a lot. Ray, I will ask if you'd like to unmute, and then Tracy, I see your hand to be next.
Yeah, absolutely. I think that obviously there's a need for more dual diagnosed opportunities for folks, both in transitional housing or transitional long-term supportive housing. So I think that the team has done a great job of trying to do that when money was available and continues to be available. So just continuing that route. I think that there's huge opportunities, though, to be focused in provider networks in terms of what type of providers are available in our community. I think language accessibility, cultural competency, and biculturalness is something that we need to focus in on. So it's not necessarily like an expansion, it's more of a targeted approach to outcomes and to who and what gets funded in terms of addressing the need. I think that we should look at the data and identify that we are focused on ensuring that there is a continuum of care that addresses all community language and bicultural needs. We know that there's better outcomes as a result of that. I think in addition to that, I think that there's also opportunities to focus in on toxic stress, which is kind of played out in different avenues of court mandated or probation mandated or system involved families. But I think addressing the contracts to also address the reduction of toxic family stress, which might be and might include financial reasons behind it. So in combination with kind of a guaranteed income program or some level of stipend would, I think, increase the outcomes of those families that we're trying to impact so deeply. And so I think that there's opportunity to identify those and to figure out ways in which to be a better service to our community.
Thank you for that sharing, Ray. Appreciate that. Tracy.
Thank you. I just wanted to address the idea of peer services being expanded. Definitely the peer community appreciates having MHCAN and having Second Story and having those connections to people with lived experience. I also work at telecare, and having the MHCAN peer in there has been very valuable to the clients because they're getting really that support that only a peer can offer. So I agree with having more peer positions throughout all the programs in the county. I also would ask that attention be put on hiring peers that are more peer oriented rather than clinically oriented. It's really tragic to see a peer position where the person in that role is being asked to be more of a clinician than a peer. So just having a really strong emphasis on finding people who care and who really are in touch with that part of peer support. I know, like at Second Story, the manager there, Adrian, tends to hire people that have heart. And that has been, I think, the key to having really good peer support in that program. So thank you very much.
Thank you for sharing that, Tracy. Dee, go ahead.
Oh, sorry to take up time twice.
No apologies.
I'm also a member of COPA, and I have to say that I'm a little bit out of the loop at the moment, but I know that Murdy has just been such a fabulous resource. And I wondered if you had been able to go 24 hours at this point. And I guess if not, I guess
Yeah, not yet. So that's what we're hoping to learn from you guys next week.
Oh, okay, great. All right, thanks.
Thank you for answering that, Karen. All right, I'm seeing a little bit of a slowdown in hands, but we're just going to hold for a minute. Again, if there are some program or service strengths or successes that you have seen or been a part of, would love to hear those. Where can we continue to build on those? Again, based on your experience, what you heard tonight, what you know as a community member or a colleague, what are still some of the gaps that exist? What do you see as solutions to those gaps? And what can current programs continue to do better to really build and expand for the next 3-year period? Kayla.
Hi, thank you for leaving some space for us. I just wanted to share that I work with a program called Wellness Connect, and it's a rather new program. And we've gotten a lot of really positive feedback from the community, and I wanted to share a little bit about that. We have very low barriers to being able to accept folks into our program, and that's been really helpful. So I think working to create programs that welcome more than just quote unquote specialty mental health, and really in the prevention piece of getting to that place, right? So supporting folks, even if they don't quite meet crisis criteria or, you know, higher level of need criteria, so that it doesn't get there. Because we've definitely had a lot of really great success in supporting folks early on in their mental health journey, and actually preventing it. So far, like I said, we haven't been around that long, but preventing things from getting worse. So I just think more of that could be good. So more preventative services or early intervention services, or just lowering the barriers so that folks can enter some of these other programs even before they meet specialty mental health criteria could be good, because it's worked really well for our program.
Thank you for sharing that. And that experience is great to bring into space. I'm seeing Therese.
Thank you. So we run a helpline in English and in Spanish. And so we've been here, I'm just going to give feedback on what we're hearing from our helplines and our support groups. We have about 10 a week. One, that the Merton Murdy team has been just a night and day for families, and the outcome and what happens and has been great. As opposed to have a police response. The other thing is that, you know, I'm on the behavioral health, I go to a monthly meeting with children, but parents are still having trouble getting, you know, there's a wait list. And so when their child, you know, is hospitalized and they get out and they can't find providers for months or a month, it's a big impact on the family and the child. So that's a gap. Stigma is really still out there. And it's stigma. And so having outreach, that's what Ray said, culturally responsive. So we have a helpline in Spanish. And so our Spanish groups were growing it, and we have to grow it one family at a time. And you know, it's really grown. I have 2 years of, so we have support groups for peers, but trying to stigma is really we're noticing in the Latinx community of those who speak English. So how can our programs are not? So our question is, how can we? What can we do in our outreach? Because as we all know, if you address the mental health condition early, the trajectory of a person's life is, you know, the illness is much greater. So that's my comments. So thank you so much for this forum.
Thank you for sharing that. I saw some hand claps and some agreements as you shared as well from others. Let's see. I think Richard, you were next, and then Andrea. I'll move
Yes,
there.
Teresa Adam just remind me something that I left out is for parents is respite. They need respite care, both for the parents' sake to have a break, time for their own, and for the child to be away. I used to be social worker aide with the County of Monterey Children Mental Health Services. And that's all I did was I went into the home to take the child out of the house for a few hours, half the day, or a full day if I match up with 1 or 2 other kids, depending if it's appropriate. And that's a life-saving for the parent, because it's not easy raising a child with a mental illness, especially with severely emotional disturbance. It requires a lot of parenting, a lot of patience to deal with those behaviors. So respite type home would be great, where they can just stay for a day or stay for a weekend, so that it doesn't become an abuse issue, so it doesn't become a neglect issue, so it doesn't become a stressor on the parent. And I did work in the crisis residential program that was short term, where we took those kids and the parents got parenting classes while the kids were living there, how to deal with their child. And the curriculum came out of UCLA that the agency used, and it worked extremely well with children with behavior disorders to get the child in control. Because when I taught the parenting classes, one of the questions I asked in the parenting support group training is, who is in control of the house? The child is. Well, we can reverse that if the parents set limits, rules, boundaries, and they have to do it. That's the only way the child is going to learn about their parents' expectation. If the child doesn't know, the child's going to take advantage of it. If the child knows how to push the parent's button, the child's going to do it. So that's where you use ignoring techniques. Eventually, the behavior will go away. Behavior modification works. It's been proven. So that's another model that it can be offered or added, or well, it needs to be added. That's all I'm going to say, for the sake of the child, for the sake of the family as a unit. Thank you.
Thank you for sharing that. So some parent respite and support. Thank you for sharing that, Richard. Andrea.
Hello, I'm Andrea Tleo. I'm the program director for Suicide Prevention Services and our 988 Lifeline. And I think that a couple of things that have worked really well this past year, which has been a time of tremendous growth for our 988 Lifelines, is really being able to have some of those very clear and honest conversations with our community partners. And really looking at where are we now, and really assessing kind of what's going on, and really, as an example, really working with our 211 partners, because they have a resource, they keep up all the resources. And so why are we trying to do it on our end as well? And why don't we just use their database? I mean, there's just little things like that, but I find that even with our 911 partners and our Office of Emergency Services and NAMI and Monarch and all of our partners, just knowing what folks are doing and talking about it and looking at how can we do things better has been incredibly helpful in terms of moving our program forward and being able to serve the folks calling our line. So just thank you to all the great partners out there. I really want to do a shout out. So thank you.
Thank you for sharing that. And I think even the importance of those incremental changes and conversations that matter to get there. So thank you for bringing that forward. We have a few more minutes that we can share, so I'm going to hold just in case someone's still thinking about what they want to share. If you'd rather throw something in the chat, please feel free to do that. We are going to grab those messages as well. And then for anyone who joined late, while I give people just a minute to think, remember we are recording tonight, so if you missed the presentation part and you are just now catching the conversation, this will be posted to YouTube. And on YouTube, you will be able to make further comments. There's a survey. We'll go over a few of those pieces again at the end, but you will continue to have opportunity over the upcoming weeks to make comments and provide feedback. Ray.
I was just going to plus one Teresa's comment about providers. The wait lists across the board from from low to moderate to higher end need for clinical support is just tremendous in our community. It's such a need to be invested. And I know the Alliance tried to do some investment with some providers. I know there's some state grants that are trying to bring in more providers, but we really need to rethink about a pipeline and investing in encouraging people into these careers so we can have more appropriate providers over time. I know there's a lot of organizations that are doing unlicensed at this point in time, but training individuals through the process to try to keep and grow more providers. But I think it needs to be more on the county's part to help organize and help support those opportunities by encouraging or hiring the supervising clinician to help nonprofits that might have lost their clinical supervisor like we did, to become, the ED for Family Service Agency, for instance, or helping other organizations start a program and develop those opportunities to go and support people that are recently graduated psychology or sociology, but are interested in higher levels of licensed social workers or MFTs or MFTIs. And I think that thinking about the pipeline is also an important piece. So not just the programming and services that we're hoping to do, but the infrastructure that's needed to provide those services in the future. And so thinking about some of the resources and use of those monies, I think are also important for a long-term impact.
Thank you. And again, saw some head nods and hand claps in agreement with what was being shared. All right, we probably have time for maybe one or two more comments, so I will just hold for a minute. If there's anything someone wanted to share before we move on. Okay. Well, I just want to first say thank you for everyone who shared this evening, those of you who were here to listen, to hear what the update was, the discussion, the comments in the chat. That's really important to the overall planning and the importance of really bringing together community and partners to drive that strategy forward and build that roadmap. So thank you so much for that. I'm going to go over just a few closing slides and how you can continue to be involved and be a part of the planning process over the upcoming weeks. So again, these slides will be made available. So if you are going back to grab links or see things, know that they're going to be posted. Much of this information is actually already on the Santa Cruz County Behavioral Health Services MHSA website. That was shared, I believe, in the chat earlier. It's a part of these slides, but if you go there, you can get links to these surveys. So one great way to continue to provide feedback, and I would encourage you, one, to complete it yourselves, but if you have networks that you can share this broadly with, we do have a feedback survey that is available in both English and Spanish. That will be available through February 27th. There's opportunities in there to kind of rate different programs, as well as just some open text box to continue to do what we did tonight, to share experiences, share ideas, share that feedback. So encourage you to complete that yourself, but also share that really broadly. Again, this recording will be posted, comments will be able to be made. So if that's a better fit for what works for you, you can rewatch, you can put those comments in. So both of those opportunities will continue to be available. Additionally, next week, there are some opportunities to do some smaller focus groups. So really looking to have some focus groups with clients, with family members of clients, individuals who have participated and received services, and just interested community members who want to dig a little deeper into these conversations. Again, these are posted on the website or will be, but these do require registration. We are trying to keep some small groups and we'll have those conversations over Zoom. But there are opportunities for that. There is going to be a specific one that is facilitated fully in Spanish as well. So again, another opportunity to be involved. And then finally, just where some of those key dates and information and other updates are available, there is the website link. As mentioned, there will be an opportunity once there is a draft plan for a 30-day comment period. So community can actually review that plan, provide comments. That will be taken then to the Mental Health Advisory Board to be able to incorporate into the plan to move forward. And just a reminder, we are building a 3-year plan. So not everything can happen in maybe that first year, but this is all feedback that's really important to inform the forward roadmap of behavioral health services for Santa Cruz County. All right, and with that, I will just say thank you one more time for joining us this evening. Really appreciate the rich dialogue and the really deep sharing. So thank you for that and have a really good evening.
Thank you.
Thanks everyone for coming.
Thank you.
Thank you.